This is Health Call Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the Health Call Radio Hour, now heard on more stations around the country as they join the Health Call Radio Network. Alzheimer's and dementia is not a normal part of aging. It seems that way sometimes because it seems like so many of us know someone who's going through this painful process, but there are things you can do to reduce your risk of facing Alzheimer's and dementia. And that's the reason that a group called Us Against Alzheimer's has put together an online series of webinars to teach us all about how to minimize our risk of facing Alzheimer's. Want to learn more about that today? We're going to talk with Kelly O'Brien. She is the VP of Prevention for Us Against Alzheimer's. Kelly, thanks for being here. Who's the target for these sessions?
Thanks, Lee. And that was just a perfect setup. I appreciate you starting with it's not an inevitable part of aging. The target audience for these sessions, these courses, are primarily clinicians, and I would say the allied health professionals, so nurses, health coaches, dementia care specialists, all sorts of clinicians, doctors included, but we're really focused on healthcare professionals. Everyone's invited.
Everyone's invited. Good. So these sessions are going to be about an hour long. They're live, but then also available recordings so you can watch them in your own time.
That's right.
What are we going to be focusing on here? Preventable risk factors, things that I can do to minimize. Tick those off for me.
Yeah. So what we know about Alzheimer's and dementia, there's actually, despite, a lag in scientific developments around treatment, there is a lot of evidence around what we can do to modify our risks. And there are a number of modifiable risk factors for dementia. There are obviously some unmodifiable risk factors for dementia. So genetics is one unmodifiable risk factor. You can't change that. Age is a risk factor for sure, but they are risk factors. They're not determining factors. So there are things that play a role in whether or not someone might develop, but necessarily it's not A doesn't always equal B.
Mm-hmm.
So in the list of preventable things that we can do, modifiable risk factors that we can address include things like hypertension, obesity, depression, poor nutrition, poor sleep, diabetes. The list goes on. There are 12 to 13 risk factors that we think on a population basis could reduce the prevalence of dementia by up to 40%.
40%? I'm going to cut
millions
my
and millions
chances.
of people. That's right.
Yeah, that is. And this is so important because I'm not sure that, we talk about it a lot and we've certainly focused on it on this program, but I'm not sure that John Q. Public really understands how big this challenge is. There is a tidal wave of expensive care, of, just
Right.
so many sad years coming at us, aren't there?
Yeah, actually, the population as a whole is aging, and so we do expect the numbers to explode. This has an exponential impact on families. Anybody who's going through this knows that it is a family challenge. It's not just the person who is dealing with the disease, but the caregivers and people around that person. It is a financial challenge because of the cost of care. Often caregivers have to, I was a caregiver, I had to quit my job to take care of my dad. That has an economic impact on my family, but also on the economy and on employers. So it really is a challenge that is in desperate need of addressing at the moment, and I would say the next pandemic.
Yeah, I think that's a good way to think about it. So these sessions are going to be, as I said, an hour long. Who's leading them? What are we going to learn? How's it going to work? Kind of walk me through all of that if I'm thinking about participating.
Yeah, that's the really exciting thing about these courses. So this last year we did 6 courses. In each course focused on one risk factor and the relationship that it has to dementia. So for example, last year we did hypertension and dementia and nutrition and dementia. This year we're focusing on 6 other risk factors. So obesity and dementia. We're focused on diabetes and dementia, tobacco use or smoking and dementia, depression and dementia, alcohol use and dementia. So each course focuses on one risk factor, and it is taught by one of the world's experts in those issues. So these are people that are either scientific researchers or clinicians or both, many of them, and they know more about the topic. For example, Franklin, one of our courses is on hearing loss and dementia. And
Mhm.
Franklin, Dr. Franklin from Johns Hopkins University is going to teach that course. He's the preeminent scientist in the world on this topic. And so it's an opportunity for clinicians and lay people, families, to learn from just really the best, absolute best.
That's really interesting. I just saw a study the other day about hearing loss and its contribution to dementia. So the thinking is that as you begin to lose your ability to think and put together thoughts, the stress and strain of not being able to process language and stay in touch with what's around you causes you to isolate and withdraw, and that what brain power you have still goes into trying to figure out all of those incoming cues, and it can't really get in the way of processing thought. It seems odd that something as simple as wearing hearing aids, which are less expensive today, you can buy them over the counter these days, and it seems that odd that just hearing aids can make that big of a difference, but that's really interesting research.
It is, and it's there's actually a very big study coming out this year talking about the absolute latest in science. I don't know what it's going to say. I have some hunches, but it is it could probably teach our course, Lee. I think you're right. That is one of the thinking about why this might be such an issue. It does tend to isolate people. Hearing is still a policy challenge, though. I mean, it's more inexpensive, but it's still difficult. It's still very expensive, honestly, for a
Mhm.
lot of families. And it's still not covered very well by Medicare audiology services. And there's still a lot of stigma around hearing loss. So it is a challenge, but it is really important for people to know that it is a risk factor for dementia. And by the way, hearing loss globally is the number one risk factor for dementia. So in the
Oh,
US, obesity actually tops that list,
yeah.
but globally, hearing losses. So it's really, really important that if you're having hearing challenges, that you get them addressed. It has broader implications than just the inconvenience of not being able to hear.
I had no idea that globally that was the number one risk. That's news to me. Obesity and the connection to Alzheimer's is really interesting.
Yep.
And I know that ties in because of the type 2 diabetes and the glucose intolerances that come along when
Yep.
you tend to be overweight. Um, who is that expert, and what are we going to learn there? Do you have an idea?
Actually, the expert for obesity is from the Academy of Nutrition and Dietetics, and her name is Nina Crowley. She's with the Medical University of South Carolina, and she'll be talking about things that people can do to address obesity, the latest science and interventions. We're trying to focus these courses. Each course will cover a little bit about what we know is true and what we don't know yet, and then what clinicians can talk to patients about, how to have that conversation in a culturally competent and sensitive way, the latest interventions and why it's so important. So obesity is important probably for the same reason that some of these other issues like diabetes and hypertension and nutrition are important, because there seems to be a connection between inflammation and the brain, right? And these cardiovascular issues,
Mhm.
metabolic issues are all interrelated. And, you often find people that have one chronic condition have two or three or four.
Mhm.
And
Mhm.
that I don't think is an accident. So it's not, the line is not a crystal clear from A to B, but they are related in some ways. And scientists are exploring opportunities to intervene so that it can mitigate dementia.
You used a phrase there that perked my ears up a bit: culturally sensitive, culturally relative ways.
Yeah.
That's important because the incidence of not only Alzheimer's but all forms of dementia is much higher in Black and Brown people.
That's
Tell
right.
me more about how you're going to address that, and do we know anything about why that is?
It is much higher in Black and brown people. It's also, by the way, much higher in women. Two-thirds of people
Yeah,
with
yeah.
Alzheimer's are women. And these are really important things to know. It also helps us target or think about where we should start in terms of these conversations. Um, in terms of why, it's still, jury's still a little bit out. It could be related to the fact that these risk factors that we're talking about are obviously more prevalent in some of these communities as well. And these things are not related. It's not a genetic issue, right? But but I think researchers are really looking at these, what they call social determinants of care, like the conditions in which we live and work and play, right? So the places that we live have a lot to do with our lifestyle and the way that, and what we're exposed to, right? And so it's a really complicated answer. One of the things I want to make sure that we don't walk away with in this conversation is that if anybody's not doing these things and they get dementia, it's somehow their fault. Like, I think these are all very difficult, complicated things. We all have to do the best that we can to mitigate our risk, just like putting a seatbelt on when you get in your car. But sometimes you still get in an accident and you get hurt, right? So it's not your fault. It's just a way to think about how you might reduce your risk. And these are things that we can take action on, that we can ourselves do.
So is it too late if I'm 50, 55, 65? Is it too late to start these lifestyle modifiers?
Never too early and never too late. That's the rule. Yeah. I mean, it helps. These are life course things. So really it starts at birth, right? Education, for example, is a really related. The level of education that you get is really important, and keep learning, right? Important, but it is never too late, especially with things related to obesity and smoking and some of these other issues that tend to creep up on us in midlife into older years. It's really important to address them, and it does matter. And honestly, it makes your life better anyway, right? Like, we want to all live. We don't want to just live to be 95 or 100 and not enjoy our life. And so the extent to which we can take care of ourselves along the way, we're going to have a higher quality of living.
Man, it's all about that quality of life. I'm all about having a good health span. There's
Yes,
a
yes.
good lifespan isn't that valuable if you don't have a good health span. So that's important. Yeah, I agree
Right.
with you on that. So it's interesting that you're targeting these sessions. I mean, they're open to everybody, but you said you're targeting for healthcare professionals. Don't they have enough training about this? What's going on here?
Interestingly, no. So this is part of the reason that we decided to do this. So Us Against Alzheimer's is a national nonprofit organization that's focused on ending Alzheimer's, and we focus on prevention, which is the work that we're talking about here. We focus on early detection, and we focus on access to treatment. So a lot of things. But one of the things that we recognized in our work with healthcare providers and with health systems, we did surveys. We looked at other researchers' surveys. AARP's done multiple surveys, is that clinicians actually, they may know about diabetes, for example, but they don't know about the relationship of diabetes to dementia. And the connection of these things to dementia later in life is really important for people to understand, because for one thing, it often will encourage them to change their own habits or to address this other issue that they may have been not addressing, because there's another reason to do it. It affects your brain health. But for the other reason, it helps with early detection. The more we have these conversations and normalize this conversation in the clinician's office, the more that people are looking at your health history and saying, "Oh, you're doing really great with your weight looks good, your blah, blah, your nutrition looks good. Let's get on this diabetes." Because it is important to your brain health. The more those conversations connect to brain health, the more people are aware that their brain is something that they need to also take care of, the more likely they are to actually have cognitive assessments, to be thinking about the implications of their brain health along the way and detecting any issues early.
Yeah, that is important. Give me just what you know. And I know you're not a scientist. I know you're not a researcher, but give me what you know about the latest treatments. Are we seeing much that's proving effective? I mean, the new medications that have just been approved from a couple of the big manufacturers. What are you hearing from the field on this?
I think it's a super exciting time, to be honest. I think there is a lot of scientific development. Often one treatment will beget another, right? And so we want to keep the trains rolling. We're very excited about the progress that has been made in the recent treatments, and think that that is only going to increase. It's not, there's much work to be done. We're still learning. But I do think that it's very, very encouraging. So, exciting time for Alzheimer's. I think there is a lot of hope. There's things we can do now, and there's things, coming down the pike.
So I'm going to take you back to your father's experience with Alzheimer's and recall for me a couple of the big takeaway lessons for you in that experience.
Uh, well, I think the big lesson for me was that this is a family issue. That that it is something that the system currently is not prepared to deal with in any way, shape, or form. The healthcare system is not ready. The financial system is not ready. Like often employers don't have, for example, enough benefits for caregivers. That we think often of childcare, but we're not thinking enough about caregivers who are older. And so I think my number one takeaway was, wow, we are so unprepared. Not only our own family, my own family, but just the system was unprepared to support that. And so I think that's part of what drives my work at Us Against Alzheimer's. I think that there's just a lot we have to do to be better prepared. There's things we can do within our own control and our own families to be thinking about that. But I also think there's a lot of advocacy work to be done to ensure that our Medicare system, our retirement system, our caregiving systems are improved so that we can better serve people who are dealing with chronic conditions, dementia included.
So what resources do you have or are you aware of for families who are looking for some guidance on when do we think about memory care centers and how do I pick a memory care center and who should be guiding me in nutrition and all those other things?
Yeah, well, a couple of things. I mean, one is I would commend everybody to a tool that Us Against Alzheimer's developed called My Brain Guide. It's mybrainguide.org. It's free. It actually provides a way for you to, it provides information that's customized to your particular situation. So it's not going to throw a whole bunch of resources. It asks you questions. You can take a brief, if you're a caregiver, you can take a brief, I don't want to call it a quiz, but a brief questionnaire to get some information. If you're someone who's concerned about their brain health, you do a different one, and it directs you to resources and information based on sort of where that comes out. So if you're somebody who's, for example, worried about their brain health but doesn't experience any symptoms, it will direct you to information about these risk factors, right, and how to address them in fact sheets on each of these resources. So I actually think it's a great resource for a family or a person who's thinking about, okay, what do I need to be prepared for? It will also direct you to local resources in your community.
And what's that address again one time?
It's mybrainguide.org.
Okay. And I will take care of explaining where and how to register for the Brain Health Academy. But is there anything else you want to leave us with? Any last thoughts?
I think the biggest thing I would say is there is hope. There is hope, and this is a daunting challenge, but there is some hope, and there are some things that we can all do about it. And those things, gratefully, also help improve our quality of life. So it's not, often I think, as I'm 56 and I hear my friends say, oh, it's just, she's getting dementia, oh, I'm forgetful. And it's kind of not funny, right? I mean, we kind of think that this is just coming. And what I would say is, don't accept that. Like, think about what we can all do now to be as healthy as we can for as long as we can. As you say, it's not just how long you live, your health, or your lifespan, but your health span. So, taking action as soon as you can in small steps is a great way to get started.
Well, that's Kelly O'Brien, the VP of Prevention at Us Against Alzheimer's. Appreciate you being here and telling us more about the Brain Health Academy.
Thanks, Lee. I appreciate it.